Hereby summoned to attend the meeting of the Health and Community Committee, which will be a hybrid meeting conducted remotely via WebEx and physically in the Council Chambers, Strabane, on Thursday, the 8th of December 2022 at 4 p.m. So just commence with attendance. Alderman Devaney.
Here, Karen.
Alderman Guy. Alderman Kerrigan. Councillor Boyle. Councillor Doyle.
Online, Karen.
Councillor Edwards.
Here.
Councillor Farrell.
Here.
Councillor Ferguson.
Here, Karen.
Councillor Fleming. Councillor Harkin.
Here.
Councillor Jackson.
Shaw.
Councillor McGinley.
And Shaw, online, Karen.
Councillor Sonoya Bauer. And Councillor Tierney.
Here, Karen.
And can I just do a double check, Alderman Guy? And Alderman Kerrigan?
Here, Karen, online.
Okay, thank you, members.
Karen,
Thank you.
Karen, I'm travelling home now, but I hope to be able to join on my mobile on the way home. So
That's
okay.
noted, Alderman Guy.
Okay, members, thank you for that, Karen. Item 3 is a broadcast statement. I'm going to read it to you now. I'd like to remind everyone present at this meeting in the Guildhall or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at this meeting, you're consenting to be filmed and to use and storage of those images for broadcasting and training purposes and for purposes of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. A copy of Council's privacy notes may be found at darianstrabane.com. Members, item 4, declaration of interest. If you just want to declare any now, please let me know, or alternatively, you can put it into the chat box or when a particular item arises in the agenda. Councillor Butt. Thank you, Councillor Butt. Get that noted. Anyone else? Nope. Members are going to move on to item 5, which is chairperson's business. And in light of receiving a deputation from Action Mental Health just before this meeting, I just wanted to raise their concerns to the committee and formalise some wording or an approach that was agreed during that deputation. And on that issue, I'm going to first bring in Councillor Farr, who I believe has a proposal. Go ahead, Councillor Farr.
Yeah, thanks, Chair. Obviously, we got the presentation from Action Mental Health, who are a fantastic organisation that does sterling work right across the north for people that suffer with poor mental health. You know, the services they offer, the support they provide is first class, and it's an actual lifeline to people right across this city and district. Unfortunately, we heard that they've got a lack of funding certainty. They could rely on millions of pounds from the European Social Fund, which, due to Brexit, is coming to an end in March. So they need certainty, they need continuity, they need clarity on how they're going to sustain the excellent services that they have. So what we agreed was that we're going to lobby the Department of Health to see if there's further money that can be made available for this really, really valuable service. So I have sent a wording or a proposed wording to the committee section, which is on the screen there. So it's self-explanatory. Council will write to the Department of Health to understand what extra financial support can be made available to Action Mental Health and other organisations, because he did reference the Women's Centre, he did reference the Cedar Foundation, to ensure that continuity of service and certainty of funding following the pending closure of the European Social Fund. So I think that captures, you know, what we discussed at the deputation. So I would propose that.
Councillor Jackson, go ahead.
Yeah, thank you, Chair, and thanks to Rory for bringing the proposal. And
on behalf of Sinn Féin, I'm happy to second the proposal. During the deputation, we did hear around the fantastic work and then the huge number of people that the organisation has been supporting. But what wasn't highlighted was the reasons behind why this organisation and many others right across the north are facing very uncertain times. And it's down to policy decisions that are being taken at Westminster. And I know there was the discussion and it was pointed out at the meeting earlier that it's a waste of effort speaking to officials in government departments in Westminster. And from our party's perspective, we agree. We've seen how many organisations relied on European funding. There's those that supported and rightfully so supported the Action Mental Health earlier on in the deputation, but these same parties campaigned for Brexit with little regard for the most vulnerable people in our community who rely on essential funding and these essential services. We've got parties that supported Action Mental Health in an earlier presentation, but are denying the establishment of an executive or an assembly where we can invest £1 billion in their health service, provide the certainty of multi-year budgets, and have a proper strategy to invest in mental health. So we know that the answers are here, and we can't pay lip service to the organisations that are providing a lifeline, and it was alluded to earlier, that are literally saving lives within our community and within our district. But we can't pay lip service to say that you are doing a fantastic job, but promote policies that are directly impacting their future and creating this uncertainty. So we fully support the motion that's in front, but I think there needed to be a bit of pointing out of the elephant in the room around all of this, because it isn't good enough that we're talking out of both sides of our mouth whilst acknowledging the fantastic work of local organisations, but campaigning for policies which are removing funding or blocking them from obtaining much needed funding. So, but on our behalf, we're more than happy to second the proposal. Thanks, Chair.
Thank you. Councillor Tierney, you want in on this? No, you're okay. Councillor Doyle, go ahead.
Sorry, Chair, I think maybe Sean was on just before me.
Apologies, Councillor Hargan. Go ahead there.
Thank you, Chair. Yeah, we're very happy to support the proposal as well. And as others have said, there was an excellent presentation from the representatives from Action Mental Health earlier, and they are a vital service in Derry and in this district and right across the north. And we have a huge mental health challenge, and Action Mental Health have been part of trying to address that. And as they pointed out, they have campaigned for many of the progressive things that have taken place here around the issue of mental health and breaking the stigma and fighting for vital funding. It is the case that Stormont has underfunded mental health for decades, and that it's shame, and that there's and it's unfortunate right now that we don't have a government that we can take the concern that we have about the funding for Action Mental Health and other organisations right across who are helping people, and that's obviously because of the DUP's boycott. But the failure to properly fund mental health is long-standing, as is the failure to properly protect the vulnerable as a result of all sorts of policies. But I think what we have to do as a council is we have to send a clear message that, like, losing workers who are involved in Action Mental Health, the loss of services, and the impact that that's going to have on the vulnerable right now is completely unacceptable. And we're in a situation where many organisations, our schools, our Foyle radio station, our council are faced with all sorts of financial uncertainty. So I think that in addition to sending this, we have to be clear that it's going to take a movement, a people power movement that will actually push back on the type of economic model that allows big corporations and the super elite to enrich themselves while funding for vital organisations like Action Mental Health gets slashed. I just don't think we can accept this, and I think we have to have a new way of trying to challenge this. Otherwise, we're going down the road of impoverishment for us and cuts to vital organisations like Action Mental Health. So we fully endorse the proposal, but we call on people as well to help build an anti-austerity movement that can push back on what the Tories are doing. Thank you, Chair.
Thank you, Councillor Harkin. Councillor Doyle.
Thank you, Chair. Much appreciated. And whilst I unfortunately missed the presentation, I'm aware of the fantastic work that Action Mental Health do, as well as many other organisations who are really struggling at the moment. And indeed, you know, I have a motion that I'll be bringing forward in January about a specific organisation that I'm involved in, because to lose organisations like this in our city and district who do this fantastic work is only going to compound the problems we know we already have. And you know, the point was well made by Rory around, you know, this is a focus on the European Social Fund, but it does have to be said that we do have a mental health strategy. I think that it is transformative, but it will only have the desired impact if all the mechanisms that we have, and hopefully we will have Stormont up at some point, we'll be able to commit the massive resources, £100 million a year, in order to transform that service. Because as much as I'm sure, and I know Action Mental Health do fantastic work, I would say there's a large proportion of it that is there because people can't get access to statutory services. So I think that that's important to point out. But I'm more than happy to support the motion. Thank you, Chair.
Thank you, Councillor Doyle. Alderman Devaney.
Thank you, Chair, for allowing me in, and like the rest of everyone else, no problem in supporting the proposal going forward here. Anything to do to support funding for these groups, and a number of them have been mentioned here today, is very, very welcome. Once again, I just want to go back to Sinn Féin about funding. They know the issue and around the funding, and they know the issues and around Brexit. But let me remind you, Chair, and I remember it from my time living in the Republic of Ireland before I moved into Northern Ireland, Sinn Féin were totally opposed to the Republic of Ireland joining the EU back then, and they're now the people that endorse it. So who's talking out of both sides of their mouths? Thanks, Chair.
Thank you, Alderman Devaney. Members, that's all the indicated speakers. The proposals proposed by Councillor Farr, seconded by Councillor Jackson. I heard nothing but unanimous support for it, members. So I'm going to take the motion as passed. Yeah, okay, members. Going to move on to other chairs' business. I've been contacted 3 times, twice by Councillor Tierney and once by Councillor McGinley. So I'm going to ask Councillor Tierney to raise his 2 issues first, and then I'll bring in Councillor McGinley. Councillor Tierney, go ahead.
Chair, thank you. And apologies to the other members that I've got 2 issues on Chair's business, but they're 2 what I would consider extremely important issues that can't wait until the new year to be raised. On Thursday of last week, the Department for Health announced news that Racecourse Medical Practice, who are based in the Shantallow Health Centre and the Ballyarnett DEA, had handed back their contract to provide GP services in the area. There's almost 5,000 patients registered currently in Racecourse Medical Practice. As people will know, in my opinion, the Ballyarnett DEA is one of the fastest growing areas across this council district, if not across the north, with the number of social housing developments, both social and affordable housing developments along the Skeg Link Road. Ballyarnett is an area where I firmly believe that we need improved services in every aspect of public life. and to have the threat of this GP's practice being taken out of our area is something which is causing a lot of distress and anxiety for patients. The Risk Course Medical Group are a family-run practice, and they are a practice which generations of people in Shantallow have used, from young to old. And people are really, really worried about the prospect of having to find a new GP. Members will know that there's not a GP's practice in this city, in this council area, who isn't already under severe pressure. And in my opinion, all this will do will lead to further competition for appointments in other GP practices. If what the Department for Health are suggesting as a viable option, that the almost 5,000 patients in Risk Course Medical Group are dispatched out to other practices across the city. People tell me, and I'm sure they tell others, we had a meeting with GPs not that long ago where they were telling us of the pressure that they are coming under. But people are ringing GP practices. It's not an exaggeration to say 100 times a day to try and get an appointment. And when they actually do get through, they're told that the appointments for that day have gone and they have to ring back. Now, that's not me having a go at GPs. I know that they're under pressure. But lumping another 5,000 patients across those practices is only going to add to further competition for places. In my view, the Department for Health put out 3 options. In my view, 2 of them should not be considered. One was that the Western Health and Social Care Trust would continue to run the service up until 6 months after the contract is handed back. Then the patients would be dispatched out to other practices. Either of them should not be considered. We need to do all we can to find a GP to take on this contract and to ensure that Risk Course Medical Group stays within the heart of Shantallow, because people aren't only worried about Risk Course Medical Practice, which is based in the health centre. They're worried about the future of the health centre once services are beginning to be taken out of it, and patients and footfall in that practice is not as high as what it currently is. So this is a really, really important issue for the people of Ballyarnett. But I believe it's a really important issue for the people across Derry, because they are going to feel the impact of this. And Chair, there is a growing concern. We've had it in the last conversation where we don't have a government to try and step in and do something. Same issue. We don't have a health minister that we can write to encourage to do all they can to support this practice and the people of Shantallow. The next conversation that I'm going to bring up, again, same issue. We don't have a government to direct policy. And having heard the conversation that Councillor McGinley is going to bring up, it's the same outcome. No minister to be able to support the topic which Councillor McGinley is going to bring up. There's a theme here. And the reality is we need to make sure, and we need to do all we can to support people. This council and people across our community are being handcuffed because we've got no executive at Stormont. We need to implore, in my opinion, the Department for Health to sidestep the process and do all they can to ensure that this service remains at the heart of Shantallow. But I genuinely fear that that's what we're going to have to do in every one of these conversations that are coming up, because we don't have local ministers here providing support. They are constituents, and it's a real fear. It's a real fright for the people of Shantallow at the minute. And I've a proposal that I've sent to the committee clerk earlier today around trying to do all we can to work with and support the Department for Health to keep this practice in the heart of Shantallow. And I would ask members to support the notice of motion. Thank you, Chair. And I can come back on the second.
Yeah. Well, thank you, Councillor Senior. Do you have a seconder for your motion? Councillor Farrell? Yeah. Okay. Councillor Doyle, I do recognise that you've also contacted me on Chair's business about this same issue, so I'm going to bring you in next. Councillor Doyle, go ahead.
Thank you, Chair, and thanks to Brian and indeed other members who also attended a rally outside the health centre during the week, because people are very afraid. You know, as we pointed out at that time, there's 4,821 patients in this one practice. And let's be clear, whilst it is at the very heart of Shantallow, there are people from right across the city who are actually patients at Racecourse, because at one time it was easier to be a patient of a large practice and what it was to try and get one in the city centre. So there are people all over the city and district who'd be affected by this. And look, granted, what this comes down to is, a GP practice, but we also have to look at all the linked services that could be affected if the Department of Health don't get their finger out. And people go there. There's a health visiting service. There are services for young parents, right up, and all the clinics that is entailed in that. I've spoken to staff who are particularly worried about their future because if, as I say again, and Brian has reiterated this, the impact is that this service closes. Those staff probably will have to either be distributed elsewhere and face massive changes to their terms and conditions, or what we will see as those services closing, and that's absolutely unacceptable. And I have to say that what this comes down to is I genuinely believe that the Department of Health have dropped the ball on this, because the main reason why this is coming about is because the one of the practice leads is retiring. Now, it doesn't take a brain surgeon to work out that someone of a certain age in a profession such as this is going to retire around a certain age. So how they didn't know this was coming, I don't know. But certainly, I have no issue with what Brian has proposed here. I will say, Chair, and I'm happy to have any discussions around it. I've also sent in a proposal, and I would maybe I don't know whether you've seen it, or if maybe it would benefit if we merge both of them. But regardless of that, I'm more than happy to support what Brian has put up here, because it's absolutely essential we do everything we can. Thank you.
Thank you, Councillor. So just for clarity, we'll deal with this motion first, unless it's an amendment. Councillor Doyle?
No, it's a wee bit different, Chair, but if
Is
we
it
want to
different?
do that, I don't mind.
Yeah, we'll deal with it separately. Councillor Harkin, go ahead.
Thanks, Chair. Yeah, I think that the GP services and the racecourse practice are a vital community resource that we can't afford to use. And I've been down in Chantal myself with party colleagues talking to people, and it's clear that everybody that is uses the service wants it to remain, and are very concerned and very alarmed about the threat to the service. And I agree with the main thrust of this proposal, which is to say to the Department of Health and the Western Trust that they need to do everything they can to make sure that the service is maintained and protected. And look, there's petitions, there's been protests, there will be more of this. There's council motions. I think everybody is behind this, but I think we have to fight to protect this service. But this is happening in the context of GP services right across the north being threatened with collapse. We've seen them collapse in some areas, and this does come down again to a failure of planning in Stormont, where there has been the work to actually properly resource GP services right across the north just hasn't been done. So this isn't happening by accident. It's not because one or two GPs don't care. There's an inbuilt problem here to a lack of workforce planning, and the fact that Stormont is down right now is only compounding that problem, because there's not even a place that we can take that's fully accountable for this. But absolutely endorse the proposal. And I think we have to look. I think people in the community are going to be the key as well to actually, saving this practice and making sure that it's not just protected but expanded. We actually need to expand the GP service there. Thank you.
Thank you, Councillor Harkin. Councillor Jackson?
Yeah, thanks, Chair. And on behalf of Sinn Féin, just say that we fully support the motion that's been tabled. I think Councillor Tierney covered the grave concerns of the people of Ballyarnett, and those concerns are something that we're hearing loud and clear through our constituency offices, and it is a very worrying time whenever you see such a vital service that's under threat. But just picking up on some of the comments that have been made. I know Councillor Doyle made a point of, first of all, I think we're all, you would like to think that every single person in this committee would be fighting and doing everything we can to maintain vital services. But in relation to a point that Councillor Doyle made around the Western Trust, didn't see this coming because it was down to somebody, a senior doctor retiring. We had a deputation from the Trust and from GP Services, and they pointed this out, and they've been pointing this out for the last 5 years or more. No, they've been highlighting that this is coming at us, and they've been sort of highlighting the fact that this isn't going to be an isolated incident. This is something that's threatening and challenging every health or GP practice right across our district and right across the north. But whilst we agree with the proposal, and I know there's another proposal which I haven't got sight of yet. But one of the important elements to this, and I know it's something the council's fully committed to, but it's the recruiting and training of our future doctors, because that has to be an important element of any workforce planning that's been referenced. I know our council have been strong advocates for the medical school at McGee, and the need to train doctors, medical professionals here within our district, and that's the answer to this. It's so it has to be contained in any solutions in relation to our council's position. We're fully committed to addressing that problem, creating opportunities, and creating security within the profession. But the reality is that it's taken us far too long to get to this stage in terms of the medical school. We need to build on that, and we need to continue to attract people into the profession, to secure services such as the medical centre in Ballyarnett and right across our city and district. Thanks, Chair.
Thank you, Councillor Jackson. Alderman Devaney.
Thank you, Chair, for allowing me in. And look, our party have no problem in supporting the proposal coming forward here. And look, you know, at the end of the day, it is concerning that this practice could close. And if it did close, what happens to the staff? What happens to the patients that are belonging to them? Quite a number of them. Are they going to spread over other GP services and exacerbate the problem they have? But Chair, look, once again, we have no problem in supporting the proposal, and just once again, the failures within the health service just haven't happened overnight. They have been there for well over a decade, and I do believe the health service has to get it, or department has to get it right here, as in around recruiting and training staff for our services, whether it's for GPs or even for our hospital settings, for doctors and nurses. But happy to support, Chair.
Thank you, Alderman Devaney. Councillor Farr.
Yeah, thanks, Chair. And, you know, I'm a Ballyarnett councillor, so I felt it was incumbent on me to speak. I didn't want to be left out. So there's been a massive, population growth in Ballyarnett, over recent years. If you look at the Skeig Road, there's development springing up left, right and centre. You've got Clonela, Clondara, Berravale, and they all contain really, really young families, and young families have a tendency to grow and get bigger. So given this, GP services across Ballyarnett need expanded and extended instead of being stripped away. And the Department of Health needs to step in to ensure continuity of service. They can't allow this vital service in Ballyarnett to just disappear overnight. And I'm being contacted by people right across the city who use this service, and they're asking, what happens? Because they're being told if a solution isn't found in 6 months, they have to go to a different GP practice. And they're asking me, and there's people in Craigan that are patients at that practice. It's not just Ballyarnett. And they're saying, where am I going to go? Because there's fear, there's uncertainty out there. Nobody has a clue what's going to happen. So this needs to be resolved once and for all. And people need clarity that this service is going to be maintained. Thank you.
Thank you, Councillor Farrell. Councillor Donnelly.
I'm good, Chair. Thanks for allowing me to speak. I'm not a member of this committee. Look, a lot of what has already been said, what was on my mind, a lot of it has already been said, but I just want to, state my position that I am aware that this GP services, it has literally been, I'm aware of situations where it has literally been a lifesaver, and that's within the last number of weeks. As has been pointed out by the previous speaker, there's people, I've been talking to people from Craigan and at Brandywell and Waterside who use this GP, that's where they're based. And I just think it's very important that we as a council, that we have to fight, and we have to fight hard and ensure that this situation is resolved. Thank you.
Thank you, Councillor Donnelly. Okay. Thank you, members. Councillor Doyle, I'm minded to take your motion as an amendment. It's on the same issue. I think it would be silly to debate those independently. There's a few other actions in it. If you're happy to take that as an amendment and an addition to Councillor Farrell's motion. Councillor Tierney, apologies, Councillor Tierney.
Yes, Chair, absolutely, no problem with that.
We're going to get them both up on screen here, Councillor Doyle. And we also need a seconder for your proposal, Councillor Doyle. Yeah, Councillor Tierney second it. Yeah, there we go. Okay, members, we have the amendment proposed by Councillor Doyle, seconded by Councillor Tierney. Does anyone want to speak on the amendment specifically? No. Anyone want to
Chair,
go?
sorry,
Yep,
Chair, for interrupting you.
Go ahead, go ahead.
Very, very briefly, it was just a comment that Christopher made, and he's absolutely right in what he said. Because the point I suppose I was trying to make was, yes, Western LMC and the BMA in particular have been trying to tell us, and have been telling us for a long time, that this could happen. The point I suppose I was making at that point was how the Department of Health itself, and it was the department that I mentioned, still haven't copped on to the fact that that this is a major risk and it is now on our doorstep, is unbelievable. But it's important also to point out that one of the things that BMA has also been telling us is that the impact that a GP practice closure could possibly have to health inequalities. Rory's right, and of course so is Brian. Where the three of us are Ballyarnett councillors, we see those new developments springing up. It's a major area of development for the city and district, and what this comes down to is we could have people, if this isn't sorted out, from places like Clonida and Berryvale having to go to the waterside, if that was even possible, which I don't think it is. So has to be at the top of the pile in terms of the inbox of senior civil servants. But I just wanted to clarify that. Thank you, Chair.
Thank you, Councillor Doyle. Members, I have no further indicated speakers. Everyone seems happy with the amendment. We'll take it as passed. And also with the substantive motion as well. Everyone seems happy with that. Yeah, members will take the substantive motion as passed. Okay, members, Councillor Tierney, your second issue, go ahead.
Yeah, Chair, thank you. Chair, as members will know, the New Decade New Approach Agreement was published by the Secretary of State and the Taoiseach in January 2020. In Annex A of the document, the UK Government made a series of commitments under the UK Government financial and economic commitments to Northern Ireland. The commitment was made to provide funding to the Northland Centre under addressing Northern Ireland's unique circumstances, where it says the government will make funding available for a range of projects aimed at supporting community and reconciliation initiatives to remove barriers, bring the people of Northern Ireland together and build a safer, more secure society. This could include areas such as additional funding to support mental health, tackling paramilitarism, a culture and community fund, and even a UK contribution to the International Fund for Ireland, among many other important commitments. But it also includes additional funding to support the Derry/Londonderry Addiction Centre. A Westminster Hall debate on the New Decade New Approach commitments to a Derry Addiction Centre was brought by SDLP Foyle MP, Colin Eastwood, and during the debate, the invaluable work of Northlands was outlined, and Northlands received cross-party support. The Government Minister, Steve Baker, said during the debate that the government was firmly committed, steadfastly committed, to providing the £1 million funding. Mr Baker described Northlands as a very valued service and said it seemed a very sensible approach to use Northlands to deliver what is required. He continued that this money needs to get on the Northlands and to deliver against the New Decade New Approach commitments. And in a recent written answer in Westminster, tabled on behalf of Northlands, Mr Baker confirmed that the UK Government stands ready to provide £1 million funding to support the Derry/Londonderry Addiction Centre as set out in the New Decade New Approach Agreement, and we are currently awaiting the Northern Ireland Executive's proposals for delivering the centre. The former Minister for Health, Robin Swan, just before the collapse of the Executive, answered a series of questions on the New Decade New Approach commitment. And in summary, Chair, the former Minister advised that following discussions with the NIO, Department for Health officials, along with the Public Health Agency and the Strategic Planning and Performance Group, as the Commissioners of Substance Use have been looking at developing proposals for the allocation of funding under this commitment, including by carrying out a population-based, needs-based assessment of substance use and related services in the Western Health and Social Care Trust area, and a review of inpatient Tier 4 services across the North is also being commissioned. Chair, Northlands is already providing excellent treatment to people right across the North. However, the independently run centre was never purpose-built, and for over 10 years, Northlands have had shovel-ready plans for a new centre of excellence to support people and their families right across the North. The latest NISRA statistics make frightening reading as they show that 350 alcohol-specific deaths were registered last year. These stats show that on average, almost every day in the North last year and the year before, someone died because of the way they misuse alcohol. Tommy Canning, from the head of treatment at Northland Centre, put it that if someone was dying every day as a result of the troubles or on our roads, there would rightly be an outcry. But alcohol-specific deaths are hardly registering with the public at large. But for the families and friends of those whose lives are being lost, every day is a tragedy. And sadder still, many may have been preventable. Many may have been preventable. Chair, I attended a meeting with other party group leaders and council colleagues, along with representatives of the Northlands, a number of weeks ago, and I listened to their plans, and I've also listened to the reasons why they feel that they need this money to help develop a centre of hope. It's my firm belief that this council should do all we can to help Northlands, to help people across the North, but specifically across our district. Chair, I have a proposal which has been sent around the colleagues. It's coming directly from the outcome of the meeting that we held with representatives of Northlands. It's on the screen there now. It's very self-explanatory in many ways, but it's to implore the Department for Health to do all they can to get this plan to Westminster to ensure that this £1 million funding can be drawn down so that people in our communities can be supported, those who are suffering with addiction. Thank you.
Thank you. Councillor Seconder for...
Second.
Yep, seconder. Councillor Sinoy Barr.
Thank you.
Okay. Any members want to come in on the proposal? Councillor Jackson, apologies. You had indicated apologies.
Yeah, thanks, Chair, and thanks to Councillor Tierney. I was at the meeting with Northlands, with all our party colleagues, with all our council colleagues, which Councillor Tierney alluded to, and at the meeting, Northlands, whilst going through and acknowledging all the fantastic work that they currently do, they alluded to their plans. They increase addiction services within our city and district, and we all know the huge demand on addiction services. We all know there's countless people living within our communities that need help. They overcome addictions, and sadly, we can all think of so many friends, family who have died waiting for help with addiction. So these are invaluable services, and the need they increase and they meet the demand it's paramount. So at the meeting we had which I alluded to earlier, Northlands did request that we have a joint motion, a multi-party motion that's brought to council. They show the strength of feeling right across our council district and right across the political sphere. Everybody recognises the need for and the increased addiction services and the importance of the work that Northlands carry out, and all our organisations as well. Unfortunately, we aren't in an opportunity. We didn't have the opportunity this month. They have that joint motion, so this was the earliest opportunity, and I thank Councillor Tierney for bringing this up on the chair's business. We've always supported. We could go on the reasons behind the failure of delivery of addiction services through the lack of investment through the Department of Health and the stalemate that we found ourselves in over the last year. But I want to focus on looking forward, and when we look forward, we can't ignore the fact that there's the Northlands have got plans here. It's referred to as a beacon of hope. They step forward, they meet the need, and they provide a positive future for people who are struggling with addiction in our city and district. So, in that regard, from our party, we fully support the proposal that's in front of us today, and we fully support the ambitious plans from the Northlands. They step up and they provide and increase the invaluable services that they're providing within our city. Thank you, Chair.
Thank you, Councillor Jackson. Councillor Doyle.
Thank you, Chair, and thanks to Brian, who, as he said, gave us all pre-warning about this motion coming today. Look, I think we all know that the term Centre of Excellence is probably the nicest possible way we could put it. But actually what we're talking about here is a continuation of the world-class service that Northlands has provided, not just people in this city and district, but further afield. You know, what we're talking about here is a life-saving provision within this city and district. There's no right-minded person in this council or outside it who would think that that isn't absolutely necessary and essential for us to move forward. We all know, I'm sure we've all been involved with families and individuals who have addiction problems and who need support, and that comes in many different forms. The Northlands is the first port of call for many, as are services that are outside the city and district as well. I'm fully in support of this motion because as much as my focus in recent years has been on detoxification services. There is no doubt that the Northlands Centre and this Centre of Excellence coming forward, the issues are not mutually exclusive and indeed complement one another. So it's I had planned on bringing a very short amendment to this today to recommit us to detoxification services. But you know what? I think on listening to what Christopher said, I think he's right in terms of this motion is cross party. It's supported by, I would say, all of us. I'm going to pocket that for today because I know it goes without saying that that's the thrust of what we're trying to do here. So any support that that A2 can give to Northlands and to the provision of this service going forward, we'll be right there as we always have been. Thank you.
Thank you, Councillor Doyle. Alderman Guy.
Thank you, Chair. I'm no bother supporting this motion. And as previous speakers have said about, it was actually an idea from the Northlands team themselves that we would do a collective motion of support for the Northlands Centre. I didn't attend with the rest of the group leaders, but I did attend, me and my colleague Ryan, Alderman McCready, with the former Health Minister, Robin Swan. And Robin was very impressed by what he's seen, very impressed by what he was told, and the fact that it was basically lived life experience of staff that added to the success of Northlands over the years. And I believe that's a major factor in how they've been so successful. Because sometimes reading out of a book doesn't give you all the answers. But no problem supporting the Centre of Excellence. I think it's when we seen round the building there the last month, you know, it's far from adequate. And it's shocking that it's actually taken so long for it to even get to this stage here. But look, I speak personally on how much help and assistance Northlands gave a family member, and even the family members of that person affected through addiction. And it was well received, and I was very thankful of it at the time. So no bother supporting this here, Chair, and thanks to Brian for bringing it.
Thank you, Alderman Guy. Councillor Gallagher.
Thank you, Chair, for letting us in. I'm not a member of this committee, but I too attended the meeting with Northlands, and I think that one of the most important things that was coming out of it was that it was, you know, the strength of the collective council, this council, of supporting this proposal. This is why I'm coming in on this today. That if these plans come to fruition, it will be very supportive of the people of Strabane, which I very much welcome. On the negative side, and I know this is in the new dig and new approach stuff, but I wouldn't have much faith on a lot of the stuff that's in that document getting delivered. But I think that we should all, as a collective, as a council, put as much pressure on central government as possible to ensure that these plans are met. Thank you, Chair.
Thank you, Councillor Gallagher, and I definitely agree with the Strabane element of the proposal. Councillor Ferguson, go ahead.
Thank you, Chair, and thank you to Councillor Tierney for bringing this motion through. I was in attendance with the Northlands, and I mean the presentation and the work that they do with Inner District is just goes beyond comparison. They are amazing at what they do, and they actually address the detox and how that they would work hand in hand with it at a detox centre here in the City and District, and they could demonstrate very clearly the need and how much. If they doubled or tripled in size, again, they could possibly fill and still need more room. I'm coming in again to show my support because I know it was a huge aspect that they wanted to make sure that all parties within the council were supportive, and I absolutely am. And the beacon of hope gave me hope that day, and just the ideas behind it and how far I can be taken forward was amazing. So more than supportive of the motion been brought forward today, and happy to support. Thank you.
Thank you, Councillor Ferguson. Councillor Harkin.
Thanks, Chair. Yeah, People Before Profit fully endorse and support this motion, and we very much value the work of the Northern Centre. And the Northern Centre, as has been said, carries out life-saving work with individuals and works fantastically with families as well. And it's a service that we unfortunately desperately need in our city and right across our district. And it's an organisation that we should be nurturing, helping to expand, so that it can provide the best possible services available. And as vital as it is, it's also quite fragile, because it was only in 2016 when the Northern Centre was faced with vicious and savage cuts that almost led to its closure. And we had to rally back then to keep the service open. I think it would have been unacceptable for people here to have seen the Northern Centre shut. And that would have, and thankfully that didn't come to pass, because of a similar unity right across communities and right across political parties. So I think we have to have the same attitude as regards this. And I think we very much welcomed the coverage that the Northern Centre has received lately for its ambitious plans. But now we need the Department of Health to actually step up and make sure that this business case is moved forward with urgency. And it's not going to be acceptable for this to sit on a shelf now. I think we as a council, and hopefully this motion will send that message, that we want this moved forward as soon as possible. And that we're not going to let this, we're not going to let the issue of the Northlands disappear. So fully support the motion, and thank you for bringing it forward.
Thank you, Councillor Harkin. Alderman Devaney.
Thank you, Chair, for allowing me in, and on behalf of the DUP, we have no problem in supporting the proposal coming forward here. I think the Northern Centre is well known for the great work that it carries out and has carried out for people with addictions. And as we all know, and we will all know someone who is unfortunately addicted to either alcohol or drugs or some other substance abuse, as we call it. But when I would talk to people who have loved ones that are getting cared in the Northern Centre, they talk about the professional care that they get, and they help to move them on. And many of those loved ones would say to me that addiction is out of control. But clearly, Chair, see if we lose centres like this, drug and alcohol addiction will be out of control if we don't have centres like this here. That those who suffer from this don't have that avenue and help to go down. And it's important that and I'm sure it'll get full support from everyone across the board here today. But Chair, just to finish, very happy to support the proposal.
Thank you, Alderman Devaney. Councillor Chair, I'm going to bring you back in to sum up here.
Chair, thank you. It's just a quick point, I suppose. I think there's two important aspects of everything that we've heard. Number one, that the proposal is going to pass. And number two, as all our members have pointed out, that it's passing with the full support of every party and independents on this meeting. I know that this committee was only really used as a vehicle to get this on and passed at full council in December. Obviously, people will know that we've made an agreement that there would be no notices of motion in December. Otherwise, it would have been coming forward there and would have been a joint motion. But I would just request that this is noted in our minutes, that it's a joint proposal and name each of the speakers that we made this joint, because that's the important thing. That one of the most important things that Northlands were looking for, that it was a joint thing. So I think it would be better if it's labelled that this was proposed by and list whoever has spoken, if that's possible.
Yep, just confirm with the head of directorate it's possible. Yep. Councillor Donnelly, go ahead.
Chair, no, just in light of what Councillor, excuse me, Councillor Tierney said, which like Councillor Gallagher, I'm not a member of the committee. I just want to endorse the proposal here before the committee. Addiction crosses all class and creed and religion. It's the same the same suffering and torment, not only for those who are addicted, but for their loved ones and families. So content and they put my shoulder to the wheel regarding this. Thank you.
Thank you, Councillor Donnelly. Members' full support for this, probably more than any motion I've seen in council yet, to be honest with you. So we're going to take this motion as passed, members. Members, going to move on to the next item of Chair's business. Going to call Councillor McGinley.
Good Chair, for allowing me to raise this issue. I have submitted a proposal to the committee section. If we could get that on screen just so people have sight of it while I'm bringing up the issue, that would be great. Last week, Ciara Ferguson, MLA, Councillor Christopher Jackson and I met with the CEO of the Youth Work Alliance. At that meeting, it was outlined what impacts cuts that are being imposed from the Education Authority will have on youth provision, more specifically voluntary youth provision across the district and indeed across the north. These decisions have been made without consultation with the voluntary youth sector and with no community impact assessment. The EA have stated that their aims coming out of these changes that they're planning to implement are the following: increased access to core youth provision, increased numbers of young people accessing youth provision, and increased access to safe spaces for young people. Yet the reality is that these cuts do the complete opposite. They mean a reduction in the number of days that services will be open, capping the numbers per session at 35, and limits to access the provision as junior youth services for 5 to 8-year-olds, summer schemes, intervention schemes, and the pathway programmes are not provided for within the current proposals. For those that in Strabane District Council area, this means a 33% reduction in funding for our youth services. Just take a wee second and think about that, because I think it's disgraceful. The impact of these cuts will decimate our youth service, and if they go ahead, they will result in job losses, and the impact that that will have on our children and young people will be disastrous. I speak as someone who came up through the voluntary youth service, and I wouldn't be the person that I am today if it wasn't for the youth workers that helped to guide me. Over the past week, I've been speaking with youth workers who are more worried about the impact that this decision is going to have on our young people than even about their own jobs, which speaks in itself about the dedication that our youth workers have to our young people. Our youth workers are the backbone of our community, and they should be valued and be being supported, not stripped of resources. In my own DEA of the Mayor, I've worked closely with our youth workers in resolving situations and taking opportunities to help educate young people around various topics, be it fireworks, the impact of antisocial behaviour on the community, road safety, and so many other issues. And they've been providing so many positive opportunities to our young people. So today, I, on behalf of Sinn Féin, I'm sending our complete solidarity to the Youth Work Alliance, our voluntary youth service staff, and our young people right across the district who will be impacted by these cuts. Within this proposal, I ask that we write urgently to the Education Authority, highlighting the concerns coming from this committee and demanding that these cuts are reversed and our youth services are retained. I hope that other parties will support this proposal. These cuts will impact all corners of our district, and our youth services need all of our support to have this reversed. So please support the campaign and save our youth services. Gormagh, Chair.
Thank you. Councillor Mayor, could you just ask for a seconder for your proposal? Yeah, Councillor Tierney. Councillor Tierney, you're next to speak. Go ahead.
Thank you, Chair, and thanks to Councillor McGinley for bringing the proposal, which I'm only too happy to second and support on behalf of the SDLP. I attended a meeting yesterday with community and voluntary sector youth providers in the Ballyarnett DA and the CEO of the Youth Work Alliance, and we had obviously been aware of the proposed cuts that were coming to the community and voluntary sector youth providers. But whenever you sit down with them individually and listen to how this is going to impact across our district, it's frightening. The first question that I asked was, what does this mean for Derry? No junior youth clubs, no summer schemes, and no working with 18 plus. And it is literally providing youth services, core youth services, no further work. I don't want to regurgitate everything that Emma said because I fully agree with her. But I do want to just bring people's attention to another aspect of this. There is a voluntary and community youth provider within my own DA, which stretches out and reaches people right across this district. It's called the Bud Club, and they work with children with learning difficulties, and people may be aware of them. The EA Local Youth Development Plan and the Regional Youth Development Plan states increased access to inclusive and welcoming youth space for Section 75 young people across Derry City and Strabane District Council area, and it also states support for increased access regionally to youth provision for Section 75 people as we meet their individual needs. It's my view that the proposed cuts go against those two core values within that. Chair, in the 2021 to 23 funding cycle, this organisation were committed and contracted to providing a minimum of 250 young people across our area with youth club provision. In the new funding cycle, 23 to 26, a minimum of 120 young people. So 130 young people that aren't going to, with SEN, who aren't going to have access to a youth club. There has been a 52% reduction for children with special educational needs. Now, across our council area, there are approximately 49,927 children and young people aged up to 25 years old. 10,753 are diagnosed with additional needs. Now, people will know that there are probably more than that currently on waiting lists to receive statements of special educational needs. Therefore, that figure will no doubt expand in the years to come. And what we're doing, what has been proposed to do, is to reduce the youth centre opportunities. 25% reduction in access to core youth provision for children with special educational needs within the Bud Club. They are currently funded for 8 sessions per week, but with the new funding cycle, it'll be 6 sessions per week. It's my view that all young people benefit from the value of attending a youth club for a number of different reasons. But it's also my view that children with special educational needs will benefit probably more than others. The Bud Club is the only youth club that are contracted, it's my understanding, across this district to work with people with special educational needs only. And we are, sorry, I keep saying we, I don't mean we, the Education Authority are potentially reducing that access to youth clubs by 52%. That's not something that I think that we can allow to happen. I said it earlier on, we have had 4 discussions in Chairperson's business. Every one of them, in my opinion, deserves and needs a governmental response, and we can't get it. We don't have it. We talked about people suffering from mental health, people suffering from addiction, children and young people with special educational needs. We don't have anybody who can step in to try and protect all these vulnerable groups of people. Is people really telling me that the protocol is that important? This is now the time where services across our community, people in our communities are being impacted by the fact that we've got no government. And I know, I'm going to predict it, that whenever a DUP representative comes on, they try to tell me, oh, you got your mandate at the last Assembly election, blah, 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 blah. They're right, we did. But we also have a job at Stormont to do, and that's to hold ministers to account. We can't do it. We also have a job to speak up for people. We can't do it because we don't have a government. It's about time. And if people haven't heard it in this meeting, they need to wake up. It's about time that those issues were put aside and people were able to get back to work and support the communities, support the vulnerable people across our district who are losing out on services hand over fist. And we don't have anybody in a local position who can stand up, speak out and say, I'm putting a stop to this and I'm going to support your community. It's an absolute disgrace. Councillor McGinley also expressed her and her party's solidarity with youth and community workers in the community and volunteer sector. On behalf of the SDLP, I also do that. I work with the youth workers across the Ballyarnett DA, as do my colleagues across DAs in this council. And we value and understand the hard work that they're coming under. But I don't think we can take our eye off the statutory sector either, because I have a genuine fear that these cuts will be rolled out to the statutory sector as well. And that's something that we must resist also. But the statutory youth workers on the ground must be looking at these potential cuts and wondering how they're going to cope. Because if you're a young person, you can't get into a community and voluntary sector youth club, you're going to head to the statutory one and they're going to be oversubscribed. What are they going to do? So they support their own staff, their own centres. They should be supporting the community and voluntary sector. But on behalf of the SDLP, we fully support the proposal. We send our full support to the youth workers, statutory and community and voluntary across this district, and we commit to doing all we can to help them. I just wish other parties would commit to doing the same. Thank you.
Thank you, Councillor Tierney. Councillor Harkin.
Thank you, Chair, and thank you, Councillor McGinley, for bringing forward this motion. And I think it's right that we're talking about it tonight. It's unfortunate that we're talking about it tonight, and it's unfortunate that we're talking about more savage cuts to vital services. And these will be this is going to be very detrimental to young people right across our district and from all different communities and right across the north. And it's going to deny young people vital services, especially in some of the most deprived areas of our city and district. And that's why I think we have to oppose them and call on the Education Authority to rethink this and to reverse these planned cuts. But not only is it going to deny young people access to services, this is about putting people on the unemployment scrap heap as well in the middle of a cost of living crisis. And I think that that's absolutely unacceptable. So I think that we have to send a very strong message from the council that we stand with our youth services. We stand with our young people who need these services. We stand with youth workers. We stand with everybody in the sector in saying that these cuts should be opposed. But we also have to look at the broader picture here. There's a massive 100 million cut coming at the education sector. And I think that the Tories think that our children should be educated on the cheap. And I think that it's going to take much more than a council motion, which I obviously support. I think we are going to have to build a much broader movement if we want to push back against what those in power are actually doing right now. It is going to take, I believe, broader mobilisation by communities, by young people, by service providers, by trade unions to push back against this, because everything you look at right now, we are being made to pay the price for a crisis that's been created in Westminster by a group of out of control Tories who are intent on having a big party when everybody else is getting impoverished, seeing their services cut. So I think that's I think for me, passing this motion is about saying we need to build a people power movement now to push back on this, because that is the only way that we're going to be able to shake things up and push back on these proposed cuts that are hitting us from every direction. So thank you again, Councillor McGinley, for bringing the motion. Totally supported.
Thank you, Councillor Hargan. Next speaker, Alderman Devaney.
Thank you, Chair, for allowing me in, and our party has no problem in supporting the proposal coming forward here. I think instead of cutting youth services and stuff like that, they should be increased. And I would say that as a rural councillor, because we are in rural areas, a far worse off situation than probably those who live in the towns and city. And around the funding to deliver these projects and keep these on board. Where has the money to come from? Once again, has to come from Westminster. And does everyone here think that if the Assembly was up and running, hadn't been down over this last number of months, that these cuts wouldn't be coming? We talk about, we hear full condemnation of the Tories, and I can condemn them sometimes myself. But when you look at the Tories and the funding that they delivered to Northern Ireland through the COVID process and stuff like that, that money was all welcomed. But what I will say, Chair, is, this money has to come from Westminster. And once again, I know our MPs and I know the SDLP MP will be in Westminster voicing his concern, and I've heard him voicing his concern and around issues around Northern Ireland. But the voice that is very, very silent there is the MPs from Sinn Féin who don't take their seats. So we don't hear from them. And at the end of the day, that's where their voices need to be heard. If they want funding for the likes of these organisations and many other issues and around funding at the moment, I would like to hear their voice at Westminster calling for more funding for Northern Ireland. Thank you, Chair.
Thank you, Alderman Devaney. Councillor McGinn, I'm going to bring you in to sum up here on your motion.
Mega Chair, and thank you to everybody that spoke and support. I think it's a really, really important issue that firstly, that our youth providers know that this council fully supports them. And secondly, that we do everything that we can to have these cuts reversed. In relation to Alderman Devaney's comments, and he's made these comments, I don't know how many times, about Westminster providing money. We as taxpayers in the North pay tax that goes into the Treasury. It's not a gift from Westminster to expect delivery and services. So I just wanted to make that point. But thank you to everyone that supported the proposal. And I'm sure our youth services, the Youth Work Alliance, will be appreciative of everybody's support for them. Gormaiga, Chair.
Thank you, Councillor McGinn. Councillor Doyle, I apologise, I missed you. I'm going to bring you in now. Councillor Doyle, if you want to say a few words on this.
Thanks, Chair. No, appreciate. Look, you might have missed me. No, look, it was just really to back up what all our colleagues had said. I try not to disagree with people when they're right. I know, particularly from what Brian said, I have to agree with every word he said. Particularly in Ballyarnagh, we are blessed with organisations and individuals who are holding the community together with their bare hands down there at times, dealing with difficult issues, and in particular with regards to the Bud project. So I have no issue supporting this whatsoever. Thank you.
Chair, just before you move on, just in terms of being open and transparent, I want to declare a declaration of interest as I sit on the management board of a community voluntary sector youth provider was on the Ballyarnagh DA. But just to be open and transparent about it.
Thank you, Councillor Tierney. We'll note that. Members, I'm hearing widespread support of this motion tabled by Councillor McGinley and seconded by Councillor Tierney. I've heard no one go against it, so I'm going to take it as passed. Well done, Councillor McGinley, and thank you for bringing this issue as well to the committee. Members, that's everything on chairperson's business. So I'm going to move on to item 6, which is matters arising from the open minutes of Health and Community Committee held Thursday the 10th of November. Pages 1 to 26 in your packs, if anyone wants to raise any matters arising. Councillor Tierney, go ahead. Yep, no one's got any matters arising. Okay, members, I'm going to move on to item 7, which is the determination of an application for the grant of an entertainment licence for a marquee located at Beach Hall Country House, in respect of which representations have been received, and that's pages 27 to 48 in your packs, members. Okay, members, and just to make members aware on item 7, yes, this bit here, isn't it? She was here, yeah. Okay, members, I want to welcome all parties to this hybrid WebEx hearing to facilitate this committee in a determination of an application for a grant of an entertainment licence for the Beach Hall Country House Hotel at 32 Ardmore Road. I would like to advise that those appearing at the committee are the applicant, Mr. Adam Kemp. We have 3 objectors here whose objections have been received within the 28-day period of application. I want to advise members also that a further objection was made by another individual who is unable to attend, and their objection is in Appendix 2 of the committee papers. We also have members, Mr. Paul McSwiggan from Principal Environmental Health, Principal Environmental Health Officer, who will provide members with a report on the findings of ongoing investigations into noise complaints received within the premise. I would also like to advise all those participating that each party will be allowed a maximum of period of time of 10 minutes to present their case, and following each presentation there will also be an opportunity for questions and answers. And at this stage, members, I'm going to invite Seamus Donaghy, Head of Service, to present the committee report to members.
Thanks, Chair. And members, the purpose of the report is to provide information relating to this application, which includes legislation, details of the application and the application process. Members, you'll be aware that the licensing regime aims to ensure venues which hold entertainment are safe and also avoid disturbance to people in the surrounding area. Following the consultation process, both the PSNI and the Northern Ireland Fire and Rescue Service have confirmed that they have no objections. However, there have been 4 objections received as outlined by the Chair, and these relate largely to noise disturbance. And those representations are outlined in your committee papers. Members, the Council Environmental Health team have investigated noise complaints relating to entertainment at this venue, and the applicant was requested to commission an acoustic consultant to carry out a noise assessment. A key mitigation measure outlined in the noise management plan is the installation of a noise limiter device to assist management control noise levels from the premises. The applicant has also been requested to consider noise impact at a number of dwellings in the vicinity. Members, wedding functions take place in this marquee Monday to Sunday each week, with both live bands and DJs providing entertainment. You'll be aware of the Council's hearing protocol, which is to be followed when determining licence applications. And Chair, the recommendation is that members determine this application following consideration of representations made, with a view to either granting a licence with or without terms, conditions or restrictions, or refuse the application. And the applicant has the right of appeal within 21 days should Council refuse the application or attach terms, conditions or restrictions to the licence which they are unhappy with. Thank you.
Thank you, Seamus. Members, any questions at this stage? No. Okay, invite the applicant, Mr. Adam Kemp, to present to the committee, if you're online there.
Hello, can you hear me?
The volume's just a bit low there, Adam.
Yeah.
If you
make it. Is that all right now?
Yeah, you might have to speak just a little bit louder there, Adam. Just
okay,
Yep,
so
go ahead.
Hi everyone, my name is Adam Kemp. I'm the one of the owners of Beach Hill Country House. We're just located in Ardmore, just outside the city. We're a small business. We employ 60 people in the local community. Beach Hill has been operating for about 30 years as a country house hotel. Now, since the reopening of COVID, we've been mainly doing events, and those events are, I suppose, 90% weddings, then it would be other corporate events. So the entertainment license integral to operations of the wedding event in the pavilion structure. Summer 22, we had quite an increase in the number of weddings, and that was mainly due to after the COVID closures, a lot of the 2020 and 2021 weddings postponements were squeezed into summer 22. So there was quite an increase there. And we did see a number of noise complaints within this summer. Those complaints, I suppose they were used to maybe on a Friday and Saturday wedding, and then subsequent to that number, there was maybe on a Wednesday, Thursday. So there was an increase for this year. The complaints, how we dealt with them, they were usually through phone calls. So we would then take that. Our controls internally would have been to get the band or the DJ to turn down. The band and DJ do play through their own system at that time, so it was a wee bit challenging to get them to the correct levels. Also, our general manager had given out her direct phone number, mobile number, to any neighbours that complained, so that they could contact her on the event if they heard noise at their own premises. Staff at that time so they were caught between a rock and a hard place, because you would get neighbours that were quite, I suppose, annoyed at the noise disturbance, could have been quite rude and aggressive on the phone, and then they and management had to then deal with getting bands under control on that time. So we then engaged with EHO in August, and the first thing we all agreed was to get an acoustic consultant to do evaluation of the site and the structure. From that, the solution was determined that we would get control noise at source. So we purchased a PA system that we would install, and within that PA system had a sound limiter inbuilt device. So how that works is input of noise from bands or from a DJ would go through this system, and we control the output volume, and then we can also remove certain frequencies on the output. Frequencies generally like bass that would cause quite an annoyance. We can remove that from the broadcast or the entertainment. That's due to, I suppose, supply chains. We ordered that system. It wasn't until near the start of November, mid-November, that was fully installed. We have operated one wedding through that system, and we've done one night's testing after that with the EHO present and the sound consultant and the engineer present on that. At the different properties on that night of testing, that we were actually had measurements on in the marquee and also at the different locations. The music was deemed to be barely audible at the levels we set. However, there was a frequency coming through of 50 hertz, and that we were able then to remove that out of the spectrum of sound, so that no more applies on any of the entertainment going through the limited system. It shows that the system that's in place now is effective, but it still probably needs a wee bit of tweaking. There are environmental, weather conditions, things like that you just can't account for in one proper testing. So we are aware of that, and we will be continuously working on that. I have a conclusion here from the consultant's testing, which was last week. If I might just read that out, it's his words that kind of sums up what they're doing. So it's in, having listened to the sounds coming from the pavilion, I can state that with the management procedures in place and the technically limitations imposed for using the system, it can ensure that the sound breakout from the pavilion is restricted to very low values at the dwellings concerned. It is important to ensure that a balance is found between the needs of the venue to provide their services to the general public and the need for the residents to not be unduly disturbed by music sound. Both myself, that's the acoustic consultant, and Paul McSwiggan, that's the HO who you'll be hearing from, agreed that the sound was at a very low level and would not be sufficient to cause annoyance. The measures detailed in this management plan and the technical impositions detailed in this report provide a reasonable level of control that meets the needs of both parties. Just the conclusion of the previous testing. We're in control now of the total volume that is produced, and also any frequencies that we deem potentially could cause annoyance, we can remove them from the system. So I think combining this with the sound management plan, I believe now we're in full control of entertainments at Beach Hill going forward. Thank you.
Thank you for that. Members, have you any questions for the applicant? Just see if, yeah, Councillor Jackson, go ahead.
Well, Chair, just a wee bit of clarification in terms of the sound management system that's been installed. And I know saying that it was trialed once at an event, and it was trialed again at a
correct
as I suppose as a test.
Yes.
what sort of time frame? Apologies if I missed you saying that, but how long has it been in place, and has there been any events that have taken place since where the sound management system wasn't introduced?
No, it was introduced, let's say mid-November. We've had one wedding since then, as this time of year is fairly quiet. It went through the system. I was out with EHO on that night. It was a very clear night, and it still was audible. So we recalibrated after that. We did a test night, and we played at the same time. So it was 10:30, 11, 12:30 at night. We played through that system and tweaked it to get the correct total volume, and then also to remove any frequencies that we were able to measure at the residents' locations.
Oh, thanks for that clarification. Cheers.
You're welcome.
Any other members want to come in? Questions? Councillor Farrell?
Briefly, I have one question, Adam. Is there any particular reason you didn't have an entertainment license since May 2020?
I suppose that was on reopening of the business in the summer of 2021. We paid the fee, but this paperwork was never submitted, and it was literally the massive changeover in staff. Again, we know it should have been in place after the fact, but at the time, probably about 90% of our team disappeared on reopening. That was a bit chaotic.
Thanks for that, Adam. Any other members want to come in? Any online? Okay, members. Yep, Alderman Guy, go ahead.
Sure, thank you for letting me in. Basically, I just want to ask a question about the hours of the license it's being applied for. And it's to 1 a.m.
That's
across pretty much 5 or 6 days a week. If I don't have it in front of me here, so I'm just sort of trying to remember there. But I'm thinking back to the previous owners, so it's a long time before lockdown. How long have you owned it now?
September 2018.
Right.
So
going back to the previous owner, and I know that the marquee was there then. I don't ever remember, and I know you've gave reasons there because of lockdown that there seemed to be more weddings bunched together after it, and that's probably is the case. But I don't ever remember there being a lot. You might have got one on a Friday and on the Saturday again, but that was it. But I don't ever remember it being lit. I'm actually a taxi driver, was a taxi driver back then. And I don't ever recall too many late nights being called to the marquee. Usually it was clearing up around 11:30ish a lot of the time. Now, what I'm saying is, we had a massive tent for 2013 UK City of Culture in Ebrington, and any event on there had to be over by 11 o'clock because of obviously the whole 11 o'clock issue and stuff like that there, because it was in a built up area. So how does the marquee in the hotel get around that, applying for an entertainment license to 1 o'clock in the morning? Because to me, it's made from the exact same material. And unless you're going to put really good soundproofing on it, you're going to get the same issues as with the why that marquee in Ebrington could only operate till 11 o'clock at night. Thanks, Chair. That's all I'm asking anyway at the minute.
Well, since we took on the property, it was to 1 o'clock. I don't know how far back previously the entertainment was to 1 o'clock, but since we, I suppose, took it over, it's been at that, and that's what we've reapplied for. The tent structures, it's a bit more robust than just I presume a pop-up tent. It is a permanent structure, and it does have an insulation value of about 20 dB within it. I suppose that's just the entertainment nights has always been to 1 o'clock. I think bar Sunday, which is 12:30, but I have to check that.
No, that's grand, Adam. Thanks for that there. Thank you.
Thank you, Alderman Guy. Any further members? Online or in person? Nope. I think that's it. Okay, members, we're going to move on to other interested parties. We have Joanne, Margaret, and Kelsey hopefully on the line. If you just want to, if you just want to present to the committee, if you want to start with Joanne, Margaret, and then Kelsey, go ahead.
Hello, can you hear me?
Yep, perfect. Yep.
Yeah, I would like to thank you all for listening to me today. My name is Joanne. I've been a resident of Drumahoe all my life, and I've been complaining about the beach hill for countless years. But since the new ownership, I've continued to do so as the noise has increased exponentially in both volume and frequency over the past few years. I've been listening to your meeting since 4 o'clock, and ironically, it was about mental health, and I can't explain to you how much this has affected my life and my mental health. I'm objecting to this establishment having an entertainment licence, as currently since the 1st of June 2020, the Beach Hill does not have a licence and therefore should not be playing any music whatsoever since this time. The hotel has been operating unlawfully and has continued to do so regardless of countless complaints via email, text and in person. I have been collaborating with Derry at Strabane City Council Noise Department and licensing team and exhausted all avenues to try and have the noise pollution rectified. It is still a concern that even though the council are aware that the Beach Hill does not hold an entertainment licence and that there have been countless complaints regarding the noise, that no formal action has been taken to close it down. I'd really like an answer to this question, as the impact from the continual noise pollution and having to deal with the council late at night on very many occasions has had a very negative impact in my life and the lives of many others affected in this area. I speak on behalf of a lot of residents who didn't know about this process and would also be here today if they had objected and had known about the time limit. The management team have been aware of the many complaints regarding the noise and have done nothing to rectify this. In fact, they should not have been given the chance to do this, or they're still in breach of the law. On the 28th of August 2022, they were advised they had no licence, but they still continue to host weddings and loud music. At this stage, I would like the marquee venue closed down altogether, as there's no solution to this problem. And in fact, the whole time the residents of this area have been suffering, their complaints have been completely disregarded. I would also like to add that outside venues without a licence stop playing loud music at 11 o'clock at night, like Edmonton Square. We have been subjected to years of music playing well after 1 a.m. in the morning, which is totally unacceptable, even with a licence. I myself am disabled, and I can't begin to explain to you how detrimental it has been to my health and how much I'm running to my GP more often because of this. Listen to Boom Boom, and I can tell you word for word every song that's been played. And I know to some people it's not a big problem, but to me and many others it is. I just like to thank you for listening to me. Thank you very much.
Joanne, thank you very, very much for that. Margaret, are you on the call? You want to go next if you're there? Margaret, are you there? I think you're you're muted at the moment, sorry. If you want to speak. Nope. Okay, move on. Kelsey.
I'm here now.
Go ahead, apologies. Margaret, go ahead.
Good afternoon. Thank you very much to the committee for allowing us to talk. Firstly, can I say that I have always tried to work with the Beach Hill and work with the council members to try and solve this amicably. We don't want to ruin a bride's day. We don't want to ruin a business, but it's going on and on and on. It's not just one or two occasions. This is numerous occasions. And actually, it's very handy now that Mr. Kemp has said he's put in this noise reduction thing. I think the one night he said he did try it, the noise did not change. The noise was just as loud. And it's very hard over this to explain what the noise is like. The boom boom booming of the bass, and as Joanne says, you can hear every word. You go out to my garden and have the wedding because I can hear every word. It's just last summer I sat out in the back when we had that good weather. I had friends there. We had to come in. We couldn't talk to each other. The noise was so bad. So it's really bad noise, not just bits and pieces of noise. And I know numerous complaints have been made, And, but it's just Joanne and I and Kelsey and a few others that are talking about it. But we are speaking for most of the beaches, that they are saying that they can't stick this. Youngsters can't get to sleep. If you're ill, you can't go to bed early because the booming stops, and it rarely stops at 1 o'clock. Rarely. One night, actually, at 1:15, it was so bad, and we had tried and tried to ring the Beach Hill, and Joanne and I got into the car and went over. And the big house, the reception was empty, the house was empty, there was nobody about. A young man came out of the tent with a tray of glasses, and we asked, was the manager there, could we speak to her? He said she'd gone home, there was no management there. So this was at 1:20, no management there, and the wedding was still going on. It hadn't stopped, the music. It was disco music, and it was bad. So I think the Beach Hill management have made a conscious decision to blatantly disregard our complaints, and they continue with, they haven't had a license for all these months, and they don't care. They're breaking the law. They obviously are breaking the law, and nobody seems to care about it. The council have done nothing about it as well. And I didn't know very much about this legislation, so I read up on it, and it said to issue this license, the person must be of good character. And funnily, I don't know what it means, clean hands. So I don't really know that the Beach Hill have good character. They haven't listened to our complaints. They've done nothing about our complaints. They've broken every promise to us that they ever made. They promise you this and they promise you that. And they may talk about turning down the noise. It hasn't ever been turned down. So I just hope that the council take this into consideration, because they have been breaking the law. They've been having weddings for 4 and 5 nights a week with no license. And, in conclusion, I think that their application should not be given. If they give this application with restrictions, how are we to know this sound thing is going to work? Because it hasn't worked to, the one time that it's worked. So if you give him this license today and it doesn't work, we're just back to square one. And, I think my conclusion is the panel should refuse the application. Thanks very much for listening to me.
Thanks so much for that, Margaret. Kelsey, are you on the line there? Yours.
Are you able to hear me?
It's very low, Kelsey. There, it's very, very low.
Let's see. Is that any better?
Yep, that's perfect.
Okay. I have been living at my current address now for approximately 5.5 years. Now we have always found the noise from the Beach Hill to be an issue. In fact, when I contacted Derry and Strabane District Council earlier this year, I explained that the timing of my complaint was simply due to the fact that as a family we couldn't take much more. I have 2 arguments to support my objection to the renewal of the Beach Hill's entertainment licence. The first being that I find the Beach Hill management to be highly unprofessional, and that the marquee, it's simply not fit for purpose. I have attempted to contact the Beach Hill directly on multiple occasions regarding the excessive noise. Each time I have been greeted with an automated message that does not allow for recordings. I have only managed to speak to a member of staff on 1 occasion. This was in fact an employee posing as a venue manager who proceeded to deny that there was any noise coming from the venue. My husband has also attempted to contact the venue. He did so via the contact us option on their website. And from memory, this was after midnight. He provided a mobile number and we're still waiting a response. I recently requested a direct number for the Beach Hill that would be available that I could contact when the noise is excessive. I'm also still waiting a response for that request. The Beach Hill, in my opinion, has not made any effort to control the noise after I lodged my noise complaint in the summer of this year. It is my understanding that noise limiting equipment has recently been installed. This equipment did not limit the noise emitted from a recent function. I would also be inclined to say that the owner would agree. I am aware that the owner was in very close proximity to my home listening to the noise for himself. On this occasion, I was informed that the entertainment had ended. This was approximately 11 p.m. This has never happened before. I feel the only reason that efforts are being made to control the noise by the Beach Hill, which have failed, is due to the objections received towards the renewal of the venue's licence and this upcoming meeting. I attended a wedding myself in this marquee at the beginning of the year. I found the noise from inside to be excessive. In fact, I purchased noise limiting headphones for my child. I also found the venue to frequently run hot and cold. This would lead me to question that if the venue is unable to maintain and hold a constant temperature, then how is it possible to contain any of its entertainment noise? The second argument in support of my objection is the negative impact the excessive noise has had and continues to have on my family. I welcomed my first baby in January 2022. He is now almost 11 months old. I can honestly state to you that the excessive noise that comes from the beach hill has negatively impacted my journey as a first-time mum. As you would expect with a newborn, sleep is limited. The beach hill contributed to a huge proportion of the sleep deprivation. When there is a function being held at the venue, it is senseless trying to get any sleep prior to 1 a.m. I have felt at times during this noise complaint process that I've been stuck between a rock and a hard place. As much as I want to drive change, because we cannot continue to live like this, it has felt very, very challenging. There have been times this year where I haven't wanted to leave my home, and at the same time, I haven't wanted any visitors. There are times this noise has been so excessive that I feel persecuted in my own home, and it is because of this that I have ultimately forced myself to allow strangers into my home for the purposes of this noise complaint. I have buried my worries and welcomed environmental health officers into my home to conduct visits and carry out noise recordings. At this stage, I feel that more upheaval has been brought to my life than the amount of effort that the beach hill has made to control the disturbance that they continually cause. My biggest concern is that my husband and I travel a lot for work. We are often driving separately between 50 and 100 miles each day. The NHS have published that adults need an average between 7 and 9 hours sleep each night. When there is an event in the beach hill, music is playing until 1 a.m. This does not allow for much sleep when our day begins at 6:30. Music can be clearly heard along with lyrics, excessive bass and speech via a microphone. My concern is that this lack of sleep will affect our ability to maintain concentration on the road. There are many weeks our sleep is affected from a Wednesday night right through to a Sunday. Where the average person can rest at the weekend after a week's work, we are unable to, given the excessive noise from this venue. I would really like to thank you for taking the time to listen to me today. I am confident that a large number of people are affected by the excessive noise from this venue than the number of objections received. I have neighbours that feel similar to yourselves, and if it weren't for the noise complaint process being as tedious as it is, they would also make their case known. I would also like to take this opportunity to make you aware that the licence renewal objection process was brought to my attention through contact with a council member. I am certain that if the local community were more aware of this, then more objections would most definitely have been received. With respect, I am required to have a licence to own a dog. I'm required to have a licence to drive a vehicle. I'm required to have a licence to publicly trade. So how has this venue continued to operate without an entertainment licence? When this noise is excessive, it's comparable to if a car was present outside my home playing extremely loud music through subwoofer speakers. I understand that you have listened to the accounts of 3 objectors today and how the noise affects their lives, but I would ask you to empathise with us and give some thought to how you would feel if this was happening to you in your home on a weekly basis, and at times it's often 5 nights each week. Thank you very much.
Thank you for that, Kelsey. We're going to open up questions to those objecting to this application. I have indication from Councillor Tierney. And, go ahead.
Thank you, Chair. And I suppose, first of all, I want to thank Joanne, Margaret and Kelsey for their presentation to the committee today that will help inform us whenever we go on the decision-making mode. I can sense and hear very clearly your frustration around what you are living through. But in each of your presentations, all 3 ladies said that they felt that residents in the wider area didn't know about the process, and that they felt that if they had more people would have objected. And I would just like to ask, well, I have a number of questions, but the first question for the 3 ladies is, would they have any idea of how many people are unaware of the process and how many they feel that they're actually representing? Because at least two of them said that they felt that they were representing their wider community. So I would just like to know that. Second of all, I would also like to ask, in terms of your complaints on the night or in the following days with the management of the beach hill, you have said that you have always tried to work with the Beach Hill. Could you explain what you mean by you've tried to work? Because from what I'm hearing, the reason for your complaints isn't down to you. I don't understand how you can work with them. Either they're not listening to you, or there's something, a breakdown in communication somewhere. And I would also like to know, in relation to whenever you do approach the Beach Hill, what the complaint process is. I know Kelsey referenced a couple of times there that on a number of different type incidents, she's still waiting on a callback. But is it the case that you go and complain? At some point that evening, the music stops, and there's no further contact until the next event in the marquee, or is there process that takes place, a meeting between concerned residents and the management, or what way is it? And Chair, the final question that I have is probably more towards officers, in relation to, and the three ladies said that they weren't aware of the process and they were only found out about the process by contacting council. And I think Kelsey had suggested that she contacted a councillor in relation to this. Have we got any idea how many complaints have been raised with council? And furthermore, one of them, I think it was Margaret, that suggested that this new soundproofing equipment, in her opinion, I assume, is only being brought on because of this process today. When did officers, or have officers, tested? I know they've carried out tests, but have they tested it since this new equipment was brought on? Because I think that's an important question as well. But I genuinely want to thank the three ladies for presenting, and they've definitely, all members can speak for themselves, but they've definitely given me a lot of food for thought. Thank you. Thanks again, ladies. Thank you.
Thank you. Councillor Chairman, after the objectors, we're going to bring in the Principal Environmental Health Officer, so he'll deal with your last question. But Joanne, Mark and Kelsey, is there anything you want to come back on Councillor Tierney's questions there, if you want to answer?
Yes,
come back
absolutely.
to him.
I have the answer.
Yep. Go ahead.
Hi, yeah, it's Joanne here. I actually have done a petition, and all but one person in the beaches signed my petition, and the one person that didn't sign it actually works in the Beach Hill. So yes, every person in my estate, I know countless people in other estates that are the same, including my family members, down as far as the Fincairn Road, that get to hear this music on countless nights. Now, it's all, obviously I'm getting a different level to what they're getting, but yes, the whole of the beaches, bar one household, has signed a petition, just to answer that question for you. The second question is about communication, I believe. I have had, I thought, very positive communication with a manager called Roisin. Me and her have had a really good relationship, and I was given a phone number and back and forth with her saying, look, Roisin, it's really bad tonight. My mum, who lives next door to me, is a teacher, and she was sitting crying. And my mum's actually had to leave her home and stay at a friend's house because she isn't getting the sleep that she needs to go and teach the next day, having to leave her home. This is how severe this noise is. I can't explain to you how bad it is. I'd like to let the girls answer the other questions, if that's okay.
Joanne, can I just ask you, the petition, how many people signed it and whether you've tabled that into council?
Well, I'm not exactly sure how many houses, but every house, bar the one, as I said. I've told the council I've done this. I've also done they give me out forms of times, dates, etc. And this has been other people out the Fincairn Road. I know personally about 3 or 4 people in the area of Dermahoe that have also filled these forms in and sent them back. I've done everything possible to show how severe this is affecting the whole community, not just myself.
Okay, thank you, Joanne. Margaret, Kelsey, do you want to come in on Councillor Tierney's questions as well?
Hello, this is Kelsey. Personally, I found with complaints, they just seem to go into a black hole. As you reference, it literally is from one function to the next. You know, and maybe Margaret maybe made reference there to working with them. You know, we give them a heads up that the noise is excessive, and we give them the chance to turn it down, but it never gets turned down. They tell us it's turned down, but it never has, and it never is. It's just very, very frustrating. You know, I'm sure, and I'm quite aware, other venues in the town have police regularly called to them because of the noise disturbance. Where I know me personally, I've never done that, because I'm always willing to work with them and try and contact them and get to turn the volume down, and it just never happens. You might as well bang your head up against a wall, in my opinion.
Thank you for that. Any Margaret, do you want to come in yourself?
Yeah, well, I just agree with everything the girls have said. You know, on the thing about contacting the hotel, I have rang the hotel on numerous occasions and the phone has never been answered. Only once did I get to speak to the manager, and she promised to turn the noise down. It wasn't, like Kelsey said, it wasn't turned down. You know, and only once did I get to speak to her, but I think she had said to Joanne and that, you know, I've asked them to do it and they're not doing it. You know, she blames the band, won't turn the noise down. But, you know, I've phoned and I never get a reply. You know, I've left messages, there's always an answer machine. I've left messages, but nobody had ever rang me back, not once. Thanks.
Thank you. Councillor, you have another question?
It's more for officers, and I suppose it's around my own lack of local knowledge, and it may be anecdotal, but can we find out in relation to that petition, the number of properties in that particular area, and we can -1, if that's the case. I would just like to have that information, and I know it would be anecdotal, I suppose, in many ways, but I think it's an important point. Thank you.
Thank you, Councillor Jenny. I'm going to bring in Alderman Devaney next. Alderman Devaney, go ahead.
Thank you, Chair, for allowing me in. And just kind of say thanks to Janine, Margaret, and Kelsey for coming in here. And I do share the frustration and around this issue. Disappointed to hear that you have been prepared to work with management and that has been given out there, but hasn't been received back. Look, I think Councillor Tierney has raised the issue about the filled-in forums. Just a pity they hadn't been forwarded in, that we could have looked at them at today's meeting and around the objections. And I take on board that your concerns and around it. One of you did say that complaints go into a black hole. It's very, very disappointing to hear that. You know, you have an establishment here, and look, generally, before the new owners, I would have had very, very little complaints, or heard very, very little complaints and around the noise here. But I do thank everybody for coming in and raising their concerns here today with the committee. Thanks.
I don't think you had any questions there, Alderman Devaney, did you? Unless I didn't pick them up.
No.
You're okay. Okay, thank you. Yep. Any other questions, members? Yep. Councillor Jackson, I do apologise. Go ahead.
Well, thanks, Chair. And I don't have a question. It's just it's along the same lines as Councillor Tierney. I just want to thank Joanne, Margaret, and Kelsey for coming to the committee, and it certainly opened my eyes in terms of the real life experiences that they're having when they come and the committee and tell their personal stories. I know we've all had opportunities to read the papers. They learn of the different steps that have been taken through environmental health officers and steps that have been taken by the business, but they hear personal declarations of how this is impacting their lives. It certainly gave me food for thought. So I just want to again pay tribute and thank the three girls for taking the time to come on the committee today. Cheers, Chair.
Thank you, Councillor Jackson. Alderman Guy.
Thank you, Chair, and thanks to Joanne, Margaret, and Kelsey for coming on here today and telling us what they've had to put up with late at night, many a night through the week. And I know it's not just the beaches. I think there's actually about 66 houses in the beaches. But I know for a fact it's Old School Field. It's other parts of Drumahoe. It is out the Fincairn. You know, and it's just getting a bit of feedback there. But no, it's all parts of Drumahoe. I know a guy I work with actually today told me that he thought there was a party house in somewhere in Drumahoe. The music was that loud. That he had to close his windows during the summer nights because he says it was, and he says he could still hear it even after that. And he lived in Old School Field. So I don't know what the you know. We'll probably need to check to see if this new soundproofing will work. I don't know. Is it? But we're saying there about them not having an entertainment license. Is that something to do with lockdown and the fact that, if I remember correctly, entertainment license were they basically given a year and a half? But I'm sure Seamus will be able to answer that there, where they didn't have to be paid for. Can I ask the three ladies too? And it's just a question here, because I think it's a problem with that whole area in Drumahoe, the way it's like a basin there, you know. There was a guy who preached in the old Park and Ride on a Sunday night. I had a lot of complaints about him. They moved the direction of the trailer, and it sort of stopped it, well, calmed it down a bit. He then moved up to the new Park and Ride, and I think the problem started again. Have they experienced the noise coming from it? And on a comparison, because I have heard that, compared to that, how loud is the music coming from the Beach Hill? Because if you're hearing it louder than you are the preacher, then there's serious issues there. But look, thanks for making your case, and well, like Seamus is up next, so we'll get his verdict on it. Thank you.
Thank you. Alderman Gave with Paul McSwiggan in next, but Joanne, Margaret, Kelsey, do you want to come back on any of Alderman Guy's comments there?
Yeah,
Hi,
just
it's
about the
Kelsey
volume
here.
of the noise.
Yep, apologize for probably. Kelsey, do you want to go first this time, and then I'll bring Margaret and Joanne in then?
Okay, thank you. I actually don't live within Drumahoe. I am more Lismacarroll area. So where you see the old Glensheen Road closed in the new dual carriageway, I'm up that road. So I'm not actually in Drumahoe itself. The noise is in excess of what, you know, I know what I know the services that are held in the Park and Ride, and from my experience, I've never heard them. I have triple glazing windows in my home. I have no vents in my windows, and I can hear the music word for word, without a doubt. I don't need to open a window. You know, it's that loud, and it's more the boom, boom, boom constantly, and it's one of those noises where if you're lying in bed and you're trying to get to sleep, it's not getting louder, but the more you're trying to get to sleep, you would nearly swear it's getting louder. It's very damaging, very, very damaging. But that's all I would like to say. Thank you.
Thank you, Kelsey. Margaret, if you want to.
Yes, well, about the preacher down the road, we could hear him in the beaches, but the Beach Hill was louder, always louder. You know, you could hear him down there. And I think when they did move it, or they did change it round a bit, it helped it a bit. You know, I don't know if doing something with that tent, but it's definitely not soundproofed. Maybe something needs to be done with that, because with it being a tent structure, we're always going to hear this. But can I just finally say that we're grateful for everybody listening to us, and we hope that this will not just be a rubber stamp, and people will take into consideration all the beaches residents, because they definitely are more than the three of us complaining about this. It's just us on representing everybody. Thanks.
Thank you. Margaret and Joanne, do you want to add anything in?
Yeah, I'm the same as Margaret. We could hear the minister speaking in the Park and Ride down that area, and then it was moved. We didn't get to hear it as much. The Beach Hill noise, honestly, unless you live our lives, you won't understand. It'll mean nothing to you, but it means a lot to us. As I say, my mum has to leave her home on countless occasions just to get a night's sleep. For me, I'm registered disabled. I've got spina bifida, scoliosis on top of chronic migraines, and I can't begin to explain to you how awful this leaves me in a state that I am struggling to get to sleep. I don't want to be up 4 or 5 nights a week to 1:30 in the morning. You know, the marquee is not a suitable structure for loud music. Now, there's been weddings in the hotel itself, and we hear absolutely nothing. So that must prove that it's about the structure, and the structure is not going to change. So they need this license cannot be after 11 o'clock. We should not have to suffer the same as Everton Square after 11 o'clock. Thank you.
Can I just say thank you to the three of you ladies there for coming back in and saying that? And was it Kelsey or Joanne at the end? Joanne? I do agree with what you're saying. It is a structure, and Ebrington had the same issues, and the people on around Bald Street. I live in Kilfennan, and in Ebrington, when there's a band on in Ebrington, I can hear the singer in my backyard, clear as day. But we were lucky enough that everything was over just around 11 o'clock.
Alderman Guy, thank you very much. I don't have anyone else indicating that they want to speak or raise any questions. Okay, members, I'm going to move on to the next presentation. That's going to be from Paul McSwiggan, the Principal Environmental Health Officer, and he's going to present a report on the findings of ongoing investigations into noise complaints. Okay, Paul.
Thank you, members. Chair. Just apologies if I do go over some old ground that's maybe been covered, but I just want to put my report to yourselves to assist in any decision making. Beach Hill Country House is located in a semi sort of rural setting on the Ardmore Road. We've already heard about the structure in the marquee and the 20 dB reduction that it's likely to provide. It's about 15 metres by 30 metres. The walls to the marquee are of a solid type material of PVC panels and glazing. The roof consists of a double skin tarpaulin, and it's filled with air to keep the layers apart. The main entrance to the marquee is via a lobby on the western facade, and this faces south, the main entrance, and there's double doors with self-closure on each of the doors. There's a second entrance and exit from the marquee to a smoking area and beer garden, and that's also fitted with closures. Internally, the main stage and the dance floor located in the southern side of the marquee, and to the other side of the marquee there's a main bar area, toilets and kitchen. And wedding bands set up their equipment on the stage, and as indicated, there can be live bands, DJs, or both. In terms of noise sensitive receptors that we've received complaints about, they're from the 24th of June, we received about 8 complaints to the department about noise. Those residents have been in the beaches, Glenshane Road, Beach Hill View, Fincurn Road, and Hazelbank Road. And there's a variety of distances involved there between 750 and 1100 metres. So you might think that would be far enough away, but not the case, because a lot of the boom boom music does travel through structures and travels some distance without reducing. And as such, there's also a valley that's been referred to. So between the Beach Hill and Drumahoe, generally you've got the Fahan Valley, and sound does travel through air rather than over ground, which can sometimes absorb noise. As part of our own investigations, we advised the Beach Hill back in the end of June about the receipt of noise complaints. As part of the process, residents were asked to fill in noise complaint record forms, and I appreciate that's been somewhat tedious for people. We've received 3 noise complaint record forms in return, and that basically indicates to us how the noise is impacting, and you've heard that already from residents. We've received the 3 noise complaint record forms back in early September, and a lot of them referred to the boom boom, the bass, the audibility of music, not being able to hear their TV, and they could hear the noise over the TV, and primarily not being able to sleep, particularly after 11 o'clock at night time, but also beforehand, able to hear the words of songs, and likewise then impacting on their health, and not being able to sleep. A number of residents also submitted what are called audio recordings through the Council's Noise app. These are 30-second recordings that they can submit, and they could submit 3 of those per 24-hour period. And 2 residents submitted those with 13 recordings over 8 nights between the 21st of July and the 19th of August from one resident, and another resident submitted 41 recordings over 18 nights on more than one occasion. As you've referred to, people have had to say that they've had to leave their home because of the noise. And again, as referred to earlier, there seems to be an increase in frequency over the summer in the use of the venue, which means that people are disturbed by noise at weekends and during weeknights as well. So environmental health ourselves, following receipt of the noise complaints, we have been in contact with the local management of the hotel. We had a meeting in August to discuss the complaints, and in particular the need to recruit an acoustic consultant. They have subsequently produced a report indicating that with the use of a noise limiting device referred to earlier, that the noise could meet acceptable levels in the residential property. We've also met with them on the 30th of November recently, after this noise limiting device was installed, to look at how the limits were set. So in total, we've received a noise report from them dated the 7th of October. Following our clarifications, received a further report from them on the 20th of October. And then we've also received a result of their noise monitoring from the 30th November visit. We ourselves have done our own monitoring and visits over a number of occasions, but mainly over September, October, November. Friday, just to list them, 9th of September, 16th of September, 22nd of September, 21st of October, 27th of October, 29th, and so on, up until the date that this noise limiting device was installed, which was the 11th of November, which we were advised of. So during our monitoring, there are occasions when we have heard the bass beat and boom boom of music outside residential property. And on occasions, we've also heard it inside residential property, and on 1 or 2 occasions after 11 o'clock as well. On some occasions, you can hear it when the noise level is very low, and on other occasions, even with some passing traffic, you do get the bass beat, but it comes and goes, and there are factors like weather and wind direction, and calm nights seem to create more of an impact than obviously a windier night, or earlier on in the day when there's heavier traffic going through Drumahoe in particular. But there's some other locations, like out the Glenshane Road, which isn't exposed to road traffic as much. But like all activities, road traffic does die down later on in the night, so any other noise is more perceptible. So when we're doing our own noise assessment, environmental health tend to look at World Health Organization standards, and they tend to set a level of 30 dB inside a bedroom, a decibel, as a good level of noise to achieve. Now, that 30 dB, I have been in properties when it's below 30 dB, and I've heard the bass beat, but likewise, over the noise measurements from road traffic can put noise levels over 30 dB as well. And I think, as people referred to there, it's the boom boom that carries, and that's specific to a number of frequencies associated with entertainment noise. And as such, the noise limiting device that's now installed is designed to take out frequencies. I think it's a bit premature for me to say that that's a success. It certainly will provide control, which is one of the main factors, I think, over the summer, that the hotel management had no control over the performances, and even despite their best efforts to ask bands to turn it down, I think they met with some difficulty in that themselves. So this particular sound system is under their control, so they can adjust the volume without the need to check with the band. So they've also submitted a noise management plan, and we have asked for a few amendments to that to include things that have been referred to earlier on, like a contact telephone number, and also actions that if somebody did complain, how they would record and what actions they would take to control the noise. But again, we just have to wait and see what the members decide. I'm not wanting to preempt that. To go back to the 11th of November is when this new sound system was installed. On Saturday, the 12th of November, I visited the area between about 11 o'clock and midnight when there was a function on. And as residents have pointed out, even with the noise limiting device in place, there was pretty obvious bass beats that were intrusive. And despite the best efforts in communicating with the hotel, that continued until I met with the owner of the hotel out on the Glen Chain Road, and I think it was acknowledged that that really wasn't suitable. Now, this was coming from a band, and I think that's one element of the problem as well, in that live bands going past 11 o'clock can be a potential issue, and particularly the issue in and around percussion instruments like drums and some brass instruments, where the normal noise will carry, irrespective of whether it's amplified or not. So subsequent to that, there was a test undertaken using an iPad playing music through the sound system, and adjustments were made at residential properties. During that night, there was a southerly wind, a light to moderate breeze, and depending on where on occasions, on a calm night, you will get the noise across Drumahoe, but sometimes wind does play a factor, so you might hear it less in some places than others. But you could, I'd have to say, on that particular night, it's strange to hear it outside the residential property, but it was there. So I suppose from my point of view, and as I think indicated by the applicant there, that it does still potentially need some adjustment if it's successful to operate. But ultimately, the structure is lightweight. There is a band playing inside and a DJ. And the first course of action is to control the noise at source and controlling the output. And based on the noise limiting device, that's now under the control of the management of the hotel. What I would say is that it has been audible, and on occasions it hasn't been audible. And I know that's a difficult thing for, I suppose, residents to hear from me as well. But I don't doubt that they have been impacted over the summer and in more recent times as well on occasions by the noise. But certainly on that, it was somewhat disappointing and frustrating on the 12th of November that I was still able to hear that. And I think that was partly due to the operation of a drum associated with the band. Once that was highlighted, the band stopped at 5 to 12. And I understand it moved to a DJ, and I stayed in the area for another half an hour, 3/4 of an hour, and wasn't able to hear anything in the immediate Drumahoe area. But so remember, that's my report. If anybody wants to come back to me.
Yep, going to open up the questions to the Principal Environmental Health Officer, or Paul McSwiggan, and just to let people know that the applicant and objectors are also able to ask questions. Councillor Doyle, go ahead.
Thanks, Chair, and thanks, Paul. Paul, I'm keen to hear about how we as a council have addressed the enforcement issue, because it's very clear that um, entertainment in the form of music in particular has been emanating from the premises without an entertainment's license for a what I would deem to be a significant amount of time, and that's been borne out by what the residents have reported to us here, as well as what you've said yourself. In terms of how we have addressed that, can you give us an overview of what exactly we've done as a council with regards to that? And in terms of, well, yeah, if we leave it at that for the first point, thanks.
Yeah, in relation to entertainment license, the only enforcement action where there's no license in place is actually to instigate legal proceedings to prosecute. Now, the first contact with the licensing section in relation to noise associated with the hotel was back, I think it was the 10th of August, and that was a complaint alleging that fireworks were being fired. Which isn't a license and an entertainment licensing issue, but I think it transpired that wasn't the source. The hotel wasn't the source of the fireworks on that occasion, if there had been. And then we received the application for the entertainment license on the 30th of August. Now, it was the 17th of September before I first received any further direct communications then from from any of the people who've made representations. The initial one was on the 17th of September, then subsequently in the coming weeks. So really, we were dealing with a situation where we had an application where the person was making an application. Now, I did, when I went out on I think it was the 20th of September, I met with Mr. Kemp and the hotel. I'd previously written to him to acknowledge the application, which in all other respects was fine, the noise being the one issue. And I did point out that he didn't have a license and that he should not be providing entertainment. But it's not, the legislation doesn't allow us to simply stop, entertainment. There's no powers available to us other than to actually prosecute. And, to date, we haven't opted for that option. It's obviously an option. It's an enforcement option that remains, but it's not one that we have taken so far.
Chair, can I follow up very quickly?
Yeah,
You
go
mentioned
ahead.
there that you spoke to the applicant when, as a result of music being audibly played. What action was taken by the applicant with regards to that when he was informed, or when they were informed that they shouldn't be playing music at that stage without a license? Thank you.
Well, at that meeting, and something which we had additionally required for this application was that there would be an acoustic report produced as part of the application. And on the morning that I met him, there was an acoustic consultant coming out that afternoon to start the process. So I suppose in that sense, he was doing what we had asked. But I mean, obviously, since that time, the entertainment has been provided without a license and has continued to be provided without a license at that venue.
Councillor Doyle, are you happy with the answers? You're not happy but content?
I'm content, Chair. Thank you.
Okay, thank you. Councillor Ferguson?
Thank you, Chair. Just thanks to Paul for the report, but I just want to double check with him the dates on which he said he received the very first noise complaints this summer, and I think he also said that he sat down with the applicant and met with them in regards to the noise complaints, just the date on that. And then a subsequent to Councillor Doyle's is it normal standard practice, officers, if an applicant has put an application in for a license for them to continue on with their entertainment even whilst they don't have the license, because it seems like, say, the application went on the 30th of August, but when he's met on the 28th of September, made them aware that they had no license, that we still have September, October, November of venue having live music and quite a lot of complaints from it. So I'm just wondering why it wouldn't have been taken further then to proceed to sanctions, whether that be legally because they had no license, or is it just assumed that whilst the process is going through that you wouldn't go through some sort of sanctions for not having a license? But Paul, just could you recap for me, sorry for my notes here, the very first complaints you received this summer and when you met with the management? Thank you.
Yeah, the first complaint we received from a local resident was on the 24th of June, and we met with the management after receiving further complaints over the summer on the 30th of August. If that's the dates, that you want clarification on?
That's perfect, Paul. Thank you very much. It just I was just wondering because I thought you said the 30th of August, and that's when the application for the license went on. Thank you.
Thank you. Councillor Ferguson. Councillor Tierney.
Yep. Thank you, Chair. Thank you, Paul, for your detailed update. Paul, you had said that this new sound system went on the 11th of November, and that you visited the area on the 12th of November, and could still hear. You then met with the owner on the Glenshane Road. Subsequently, there was a test done by an iPad, and you strained to hear it whenever it was changed from the band to the DJ. Is that right?
That was on a separate night.
That's on a separate night.
Yeah.
Right. So, have we visited the area after the 12th? And I'm probably asking you to answer a question that you might not be able to, but would you be confident that the sound system in place now will reduce the noise within the area? And whenever you said that you had visited the area, I assume you're talking about the area out around the beaches and Glenshane Road, etc.
Yeah, just to clarify, on the 11th of November it was installed. We were told on the Friday. On the Saturday, I visited the area between 11 o'clock and midnight, and made a number of observations. And there was an event on, and there was no noise audible in the beaches or in Breda Park. It was audible, so just within literally a drive, a few hundred yards down the road, and that's why I saying about wind direction. So I had to contact the, just for that example, I don't know what the song is. Tonight is going to be a good night. It was audible, in Breda Park, even with that loud ice. But on the 18th is when I met with the manager of the hotel on the Glenshane Road, and you could hear the thump that people would be really bothered by. So there hasn't been an opportunity since that. There's been no functions within the hotel. There was the test carried out on the 30th of November, and that was through an iPad playing music with nobody in the hotel venue. So, as I say, I would have preferred with the limit adjusted, the volume and the frequencies adjusted, to see how that performed with a live band, but there's been no other functions since that date on the 30th of November to allow us to do that.
You see that test on the 30th of November. What time of the day was that carried out at?
That was carried out between 10 o'clock and 11 o'clock in the evening.
Okay, thank you. Thanks, Paul.
Thank you, Councillor Tierney. Councillor Jackson.
Thanks, Chair, and thanks, Paul. I suppose I just want to start off by saying it's very evident from the reports and listening to yourself that council have went over and above in terms of investigating this, and I just want to say on behalf of our party that we appreciate that the efforts that yourself, Paul, have went to. The demonstrate the council are listening to the concerns of the residents. And I suppose in relation to the noise monitoring or the noise limiting speakers or that have been installed, have council or have environmental health have we played any role in terms of advising the applicant around what type of noise limiting speakers or what type of equipment may be suitable or may address the problem? I suppose what I'm asking, because this could be a completely different discussion if this system wasn't in place. So I'm querying, have the owners of the hotel responded to advice from council, or have we give any advice that that the owners haven't sort of abided by or went down? Because it's but one of the things that, because when I was listening to and I was struck by the comments of the three girls, but one of the comments that they made is that they felt that they haven't been listened to. What we've seen through the reports that have been sent today and through your own report, Paul, is that council are very much in listening mode, and we're looking towards finding a solution to this. So, has there been any direct advice to the hotel owners around what could be done to try and resolve this? Thanks, Chair.
Yeah, back on 30th of August, our first concerns having received the complaints in terms of looking at the noise app submissions and the continuing rise in number of complaints was to meet with them and advise them to recruit an acoustic consultant, and they have done that. And it's through that mechanism that they have obviously been in contact with a sound engineer to give them best advice. But as I say, I suppose the important thing for myself as well is that, and I've reiterated this both to residents and even with the noise limit device, you should not be able to hear boom boom music after 11 o'clock in Drumahoe. And that's what I was hoping that this limiting device would achieve, but it sort of remains to be seen. Apologies, there's a bit of uncertainty around that, but it certainly does give the hotel management control, and it does allow adjustments to be made to it. Unfortunately, I'm not in a position to say most definitely that it will achieve what it will do, but it's there, and I'm optimistic. And you've heard the comments from the acoustic consultant employed by the hotel that they're confident that it will. But again, it's how that is all managed as well. You know, the actual who has control of it. You know, is it checked beforehand? So those are the sort of things that we would like to see, depending on obviously the decisions of the council. I'm not here to say, but there are some clarification that we still need from the hotel. But they have been engaging with us, and I hope they've taken our recommendations strongly. Likewise, the staff in the hotel that I've spoke to have been fine, and they have also expressed concern about how they have had to approach bands, which is not the situation that it should be in at all. You know, it should be down. They should have control of it from the very start. And also, I've also reflected to them on how they've managed calls from local residents as well, and the frustrations of just getting an answering machine and not getting feedback as well.
Because you're actually content? Go ahead.
Just because it was a question that I had failed to ask it in relation to our hotels, that because there are other hotels throughout our district that are in semi-rural locations that are close to the residential areas. Is there any other hotels or similar circumstances where there's conditions attached to an entertainment license that have alleviated the problem? So
when I answer that, there's no hotels, if any, that have given rise to this situation. So it'd be standard conditions, terms and conditions applicable to them all. You know, there's nothing that I can think of comparable to this particular case.
Okay, members, I don't think of any further indicated speakers. Oh, Councillor Fleming, go ahead. Apologies.
Thanks, Chair. Chair, this question might be, I'm not sure if it is the Paul, but I think I just wouldn't mind a bit of clarity on it, because in some sense, at some point, we're going to be asked to make a decision on this in relation to the sort of the guidance and the laws that govern it. And you're talking about either accepting it or refusing it or putting in conditions. And I just wonder, is there a road before that, in a sense, because we've heard very clearly and articulately from the residents that their experience over the last number of months, and maybe longer for some of them. And then we've heard a very detailed report from our own council officer. And I just wonder, is there a way to, if the new machinery is meant to be in place and it seems to be, it hasn't really been tested. Is there a way to give 4 weeks without putting it down as a decision, but with the agreement of all those involved? And I'm conscious that in terms of some people, they're at their wits' end as to how they have been treated. But did you have a situation where you nearly have a 4-week trial in terms of this new equipment, and then we come back to making a more firmer decision?
Thank you, Councillor Fleming. I don't know if, Paul, you want to come in, or any officers on that?
Well, I understand the sentiment, as I say. It's in terms of the, as I say, it's only been 2 occasions when this really has been tested, or I should say 3 really. The 12th of November, you know, it seemed to be okay. The 18th of November, it wasn't okay. And then we've had a third sort of test without an event, but through music played through an iPad. So, and as I said, there probably is some tweaking that needs to be done, both the overall volume and the control of the frequencies. So I can't really sort of, it's not for me to give that advice about the 4-week period, I suppose, but I'll leave that open to others.
Yeah, thank you. Councillor Fleming, when we go into confidential, we can, I think Seamus will be able to advise on deferrals and options. Okay, members, I have no further speakers or anyone wishing to raise anything with Paul. So, members, I'm going to move on to summaries. Before going into confidential for decision, I want to move on to summaries. I'm going to ask each party to summarise their position if they wish, and I'm going to go in reverse order. So I'm going to start with the applicant. Adam, if you want to summarise your position.
How you doing? I've been listening attentively to all of that. I suppose to summarise, maybe in reverse, talking about the limiter in the device. We have only had a few nights to, I suppose, test the viability of the device. Whether you put a band through it or you put an iPad through it, the output level is the exact same. So it doesn't matter what the input is, the output we are now in control of. And previous to this, we weren't in control. It's evident. We're not denying that. It was quite stressful from our side as well, trying to get things under control, and we done the best we could, but obviously it hasn't been good enough in some instances. But we now have full control of that output through this device. In relation to the experiences of anyone that has made complaints tonight, I'm not going to challenge that. That's their experience of this. I would, though, I suppose, from listening to Paul from the HO,
it has to be objective. So when you do have certain people, everyone perceives sound, everyone perceives experiences differently, and we all need an objective measurement here. And I know we talked about the 30 dB from the WHO within a property, that's the world standards. So I'll just be mindful of that. Take on board our management of complaints. We have, I think it was Joanne says that she has direct contact with the general manager. We were given that to anyone that had it. I apologize for the other two people who are complaining that we didn't get to that level of, I suppose, connection and the communication lines put in place. Paul. I think that's everything. Yeah, so as you said there, the potential of a test window. We've always worked with the HO from day one, and Paul can probably attest to that we've never ignored it. We've worked with them, so whatever decision, we want this to work. We don't want to be annoying our neighbours. We do have a business here that's gone through 2 years of hell. So we are willing to push forward and work with everyone involved. Thank you.
Adam, thank you for that. The next is Joanne, if you want to summarise your views or position.
Yeah, my views are still the same. I believe the marquee is not fit for purpose, that we should not be subjected to music in our homes at all, especially after 11 o'clock in the evening. I hope you really listen to how we're affected. This is our lives. This is happening 4 or 5 nights a week. I'm sure you can tell by my voice, we are just at the end of our tethers with it. And I hope you really do listen. And I really appreciate you listening to me. Thank you so very much.
Thank you for that. Joanne, Margaret, if you want to summarise your views of.
Yes, hello. I just don't know how somebody can say that this machine is definitely going to work. It didn't work the first night. It sort of worked the second night. You know, I don't believe that putting music through an iPad is similar to a band playing. So it was very handy just to get this machine in at the very end of the season. You know, no music, no bands for 4 nights a week. So who knows this is going to work? We've got no reason it's going to work, and I think that tent is not fit for purpose. You know, there's always going to be noise at it, whatever level. But I thank everybody for listening, and just hope that they know the residents of the beaches are at the end of their tether and need something done about it. Thanks very much.
Thank you, Margaret and Kelsey. If you want to come in.
Hello. I'd just like to finish up by saying that me personally, I would feel reluctant to give this venue the benefit of the doubt. The fact that the venue have been very reluctant to resolve any issues that I have personally raised up until very recently, and I can't help but feel that it was for your benefit here today. And I'd ask, please do not fall for this act. The marquee is simply not fit for purpose and should not be available for use moving forward. Thank you.
Thank you, Kelsey. And finally, Paul, if you have anything you want to add in addition to what you've already said.
No, I have nothing more to add. Thank you.
Okay, thank you. Okay, members, the next step is that we're going to move into confidential business. And we get a proposer and seconder for confidential. Proposed, Councillor Farr, seconded by Councillor Tierney. And just to advise members that it will only be the members of this committee that will be able to